Hey everyone, beauty. Okay, I get hair, skin, and nail questions all the time. So I wanted to touch on my answer to a client the other day who asked a great question. She said, do you have any advice on supplements for women in their 40s or 50s to take to help with symptoms such as thinning or hair loss, brittle nails, and dry skin? Great question. Tons of people interested in this. So I thought I'd make a video. And I would say, before diving into supplements, you really want to take a functional medicine approach and start by addressing what the root cause might be before assessing what supplements to take. So why are you losing hair? Why are your nails brittle? Those symptoms could be related to one common cause, or they might have several causes. For instance, hair loss. It can be hormonal, meaning thyroid hormones or sex hormones. And this is actually the most common cause of hair loss. It could be related to stress or nutrient imbalances. It could be seasonal hair loss, which freaks a lot of people out. I'll get to that. Or it could be a mix of all of those. So to know whether it's hormonal, let's start there. Hormonal hair shedding is a faster hair shedding versus stress or nutrient related hair shedding. So you want to look at the hair on the bottom of the shower and compare the thickness of the strands. If it's hormonal, they'll mostly be thinner in diameter. So if there's a mix of thinner and thicker, there's your clue. If they're all the same thickness, this indicates it's either a seasonal thing, or it's related to stress, or a vitamin deficiency. So when it comes to stress, often a period of hair loss will follow 2 or 3 months after a stressful event. So bear that in mind. For women, especially, the hair follicle is actually more sensitive than in men. And hair follicles are some of the most metabolically active cells in the body. So they're very hungry for energy, and they're very sensitive to stress and nutritional or energetic deficiencies. And in terms of seasonal hair loss, everybody sheds about 10 to 15% of their hair from the summer to fall transition, which is generally like September and October, and again in the spring in April and May. You can also get clues about what's going on by looking at the hair loss pattern. With hormonal hair loss, women generally lose hair more diffusely around the top of the head, and then with age around the temples. And for men, the male pattern baldness relating to hormones usually shows up along the runway on the top of the head, while the sides and the back remain. So for both sexes, one thing to note is that losing it on the sides is generally due to stress or nutrient issues if it doesn't come with loss on the top. So for women, the most common hair loss inducing issues are inadequate protein, stress, which includes the way we treat our hair, illnesses like COVID, UV from the sun, hormone imbalances, thyroid imbalances, and general inflammation. So if you think your hair loss is hormonal, it's a good idea to do some lab testing. Test your sex hormones and test your thyroid. I'll add a note on thyroid here because it's super important. You want to test it not only by looking just at TSH, thyroid stimulating hormone, which is standard practice in medicine. You want to also include T3 and T4, which are the actual hormones, and ideally reverse T3, and the thyroid antibodies as well. That is called a full thyroid panel. Nutrient or mineral deficiencies are also often indicated by brittle, like dented or ridged nails, little lines on the top that run lengthways or sometimes across. So actually when I do client intakes, I always look at the nails and test how strong they are by seeing how easily they bend when you push into them. So that's a nice little test that can give you a clue. It's hard to describe here how bendy a nail should be, but it should give you good resistance when you try to push on it. It shouldn't just go whomp and bend really easily. So if you suspect you have nutrient or mineral deficiencies, it's a good idea to test for those things as well. And you have a number of options out there, generally not available through a standard medical doctor. But you can speak to me if you want to know where to go from there. Definitely, you want to test your vitamin D levels regularly, at least once a year, regardless of the quality of your skin, hair, and nails. It's a good idea to test things like your iron, copper, zinc, magnesium, and so on. Okay, so that's a great segue to bring me full circle back to the question. Once you've got a handle on what the root cause might be for your hair loss, brittle nails, dry skin, the most important nutrients for hair maintenance and growth are vitamin D, zinc, copper, magnesium, iron, and folate. And it's similar for skin and nails too. Those are all important, but I would also add to that vitamin C for collagen production, vitamin E, and the omega-3s. And for all three, hair, skin, nails, it's crucial to eat enough quality protein and healthy fats. Avoid the inflammatory fats, the seed oils, vegetable oils. And you also want to eat the rainbow. So it's just a wonderful way to approach the veggies on your plate. You want as much colorful produce as you can get on there. So there you go. Enjoy.